and public involvement and communications and engagement sits within my current portfolio and my new portfolio. So for some of you that know Sean Thornton and Karen and others in the team, they've been working really closely with me for quite some time now. So I'm really delighted to have been invited to this afternoon session, and look forward to the discussion that we're about to embark on. I think from memory, and Lenny may correct me, but I think we've got until around about 2 o'clock, Lenny. So we've got quite a bit of time. That's great. Thank you. So we've got quite a bit of time to go through some thoughts with you, and Karen has got a fantastic presentation that will take you through. As Lenny said, please ask away any questions in the chat box. We'll have some questions for you at the end as well. So we're hoping this is going to be an open discussion. Really want to hear your thoughts, your views, to really help us shape this really important agenda going forward. So without a further ado, I think Karen, are you steering the slides? Did you want me to kick off, or do you want to go straight into them?
No, that's okay. I can go straight into them.
Brilliant.
I might call on you at certain points, Helen, if that's okay.
Of course.
Okay. So I'm not going to take too long with these slides, because I think the main reason for having this Derbyshire Dialogue was to have that dialogue with you all about what you think we should be doing to involve people and communities in the work of the ICS. So I'm just going to kind of whiz through some of the principles and some of the things that we are doing, but then open it up to you to make suggestions as to what we need to do next, and input your thoughts on how we make best use of the assets that we already have, because I know we have lots of assets already that we could be using which we're not. So first of all, I just wanted to introduce these 10 principles that are underpinning kind of everything that we're doing at the moment in terms of our thoughts around involving people in communities. And they came from some guidance that was issued by NHS England for integrated care systems. But they do very much reflect everything that we do want to achieve within our work. So I'll just run through a few of them just so that you get an idea of what those principles are, so that you don't have to quickly read them. But obviously we want to put the voices of people and communities at the centre of decision making and our governance at every level of the ICS. So, you know, we very much want them to be influencing decisions that are being made right up at the top, but also from that ground level. And we need to look at systems that we put in place to make it so that we are taking into account what matters most to people. We want to start engagement very early on. You know, co-production is one of those terms that we use quite a lot, and not everybody always understands exactly what it means. But to me, co-production is making sure that people are involved in the decisions that we're making right from the beginning of any transformation programme, even when ideas are just being kind of bandied about on the table, and making sure that people are involved then in the design of that transformation, the implementation of that transformation, and the evaluation of that. So, you know, that's kind of the gold standard of what we'd like to achieve going forward. But just getting people involved in decisions early on is our first priority. And, you know, we are really working towards that. We've got a new kind of guide for all ICS commissioners and system leads, kind of spelling out exactly what they need to do in order to make sure that that happens, and we're distributing that out to people very soon. We want to understand our community's needs and experiences and aspirations for health and care. You know, again, very much about, you know, what does matter to people, how do we ensure that we're meeting people's needs, and then building relationships with excluded groups and those affected by inequalities. There's lots of work going on in the integrated care system to make sure that we address health inequalities, obviously, which were made much more stark as a result of the COVID-19 pandemic. So it is very much a priority, and it needs to be priority in terms of who we're involving in our work. We've already got really good relationships with Health Watch and many people in the voluntary sector, but we've got a whole programme of work around making sure that the voluntary sector is embedded within the decisions that are being made in the ICS, and we want to talk more about that. Making sure that we've got clear and accessible public information. You know, we try to do that as much as possible. We're always open to ideas as how we can do that better. Using community development approaches that empower people and communities, making connections to social action. That's one of the areas where we really do need to kind of really think through how we can do that better. And I'm really interested in your thoughts on that one today. Well, we could do them all better, to be fair, but that's one where I'm, we really do need to think through how we might make that happen more, because obviously people are their primary providers of healthcare, and that self-care that they provide to themselves right from the beginning is what's going to transform our health service going forward. So we really do need to make those connections to social action. We've got using co-production, insight and engagement to achieve accountable health and care services. So again, that's very similar to the one about making sure that people are at the centre of a decision making at every level of the RCS, because that's how we ensure that we're accountable. Co-producing and redesigning services and tackling system priorities in partnership with people and communities, very similar, and learning from what works and building on the assets of ICS partners, networks, relationships. That one's been a massive part of my workload this last few weeks, because I've been writing an ICS engagement strategy, and I've been trying to find out what we can build on in the system that's already available, so that we're not duplicating those networks and those relationships that already exist. So that's a really important one that we want to take forward. So I'm going to come back to these 10 principles at the end and ask for your thoughts on how we might be able to effectively implement them in our engagement strategy. But I just want to outline that we kind of have 3 different types of engagement and involvement of our Derbyshire residents, our Derbyshire citizens at the moment. We have that kind of patient experience at the point of use of service, where people kind of tell us whether they've had a positive or negative experience of using services that are currently available, and also their suggestions for improvement. So there's that kind of insight that we gather. We gather a lot of information when we change services, helping us to understand how services need to change and the impact that change might have on people. So as services come up for a review, or if we decide that we're going to transform a service in a certain way, we do quite a lot of work with people and communities then. But we also do quite a lot just kind of in between, if you like, where we ask people to advise us on their approach that we need to take to things like, what's the best way that we can communicate with people, why do people behave in a certain way? We've done research around that, how people might perceive a particular change to services, or how we motivate people to self-care. So we do a lot of kind of work in between service changes as well around those different aspects. The things kind of that we're currently working towards at the moment is this kind of having those conversations all the time, so that we're not like on a back foot every time we want to make a change to a service. We don't have to think, oh, who are we going to ask about that? How are we going to have those conversations? We're already having those conversations continuously, and we already have a lot of insight to draw on. That's what we want to work towards, and we've got quite a lot of work ongoing around that continuous engagement framework that we're all quite proud of, but we know that there's lots more that we can be doing to make sure that we've fully got that covered. we're going to be doing quite a lot of work coming up on shaping our priorities. And I was hoping that Helen might come in here, because this will be around our ICS, our Integrated Care System strategy. So Helen, I didn't know if you wanted to just say a few words about the strategy.
Thank you, Karen. Yes, so colleagues will be aware that the ICS, through the umbrella of Joined Up Care Derbyshire, has been around for a little while now, and over the last couple of years or more, really, we've been working towards some of the system priorities, the transformation that we're looking for, and of course the impact of COVID now has really helped to shine a light on some of those areas where we need to do better. One of the big priorities is around reducing health inequalities. We know that across our city and county, the gaps in health and access to care are quite sizable. So clearly that is one of the key priorities. A second priority area is around how do we better support people that have a mental health need. And thirdly, one of our biggest priorities is around access to emergency care. And we know we have a lot more to do around that. So I think in summary, they're the three big areas. And of course, underpinning all of that is around our planned waits or our elective care waits. We know, and I think we've probably all seen in the media how long some of the waiting lists are to access care. And obviously Derby and Derbyshire have a share of that locally here that we're working through and prioritising as well. Thanks, Karen.
Great, thanks, Helen. So look out for kind of that work that's coming up in the next few months, because we'll be wanting to have lots of conversations with people about how we shape those priorities, but also how we kind of co-produce the solutions as well, which is the next point on the slide, because we are wanting to ensure that we are including what matters most to people in those priorities, and also in the work of the place partnerships and the local place alliances, which are very much kind of working with people and communities on the ground around what matters most to them. And then we're like I said earlier, we're hoping to do much more joined up work with the councils and the voluntary sector, still working as separate organisations, but increasingly looking at, you know, that one population approach, because obviously, although we have multiple system partners in the ICS, we only have the one population, and people get really confused when you know, there's lots of conversations happening around similar things, and they can't understand why we're not joining up and asking the questions together, and I can't understand it sometimes either. So we do need to join up much more and work together much more to avoid that kind of duplication now that we're moving into this system approach and the system solution to the challenges that we're facing. We have, you know, lots of communication channels. These are all kind of being revamped, by the way. We've got a new kind of Joined Up Care Derbyshire website that's going to be launched the 1st of July, along with the transition of with the CCG moving over to the Integrated Care Board. So that'll look all kind of new and dandy, and we had a demonstration of that yesterday at the engagement committee, which is a group of lay people that assure the CCG around matters to do with involving people in communities. And it was all very much about making sure the website is much more easier to navigate, and the information is very clear. You know, it's clear English, it's easy to read, no jargon. So I'm really excited to be saying that we're going to be launching that soon, because it will be much easier to navigate than the current website, and much easier to find the information. We have the Joined Up Care Derbyshire newsletter that comes out every 2 months, and I try to make that as useful for people as possible, and I'm always asking for ideas of what to include, and anybody can put an article in there, any system partner. I've just included some information about a new LGBT service that's been launched in Derbyshire. I included information around carer services, so anybody can suggest an article for that newsletter. And we've also got our social media channels. But the reason I was saying that is we do have mechanisms to inform people, but we know that getting those messages out is a lot more around kind of building those relationships and trust with people. It's not enough just to put kind of messages out. We need to be talking to people face to face or virtually now, obviously. So we do have lots of other involvement mechanisms which are very much about building those relationships with people. Some of you will already know about the citizens panel. That's paused at the moment because we moved it over to a new platform and we've had some technical hitches, but it's about to be relaunched this year. And that is basically like a representative sample of the population that we can use to kind of get a temperature check about different topics. So that's hopefully going to be relaunched very soon. We've got the online engagement platform, which I think Lenny said she was going to put some links to some of these in the chat box in case you want to explore them yourself, but that has lots of different conversations on there around different health and care conversations that are taking place. It's got things like the glossop transition on there. It's got things around urgent treatment centre reviews, lots of other things that you can see. We've got the patient participation group network. Patient participation groups are attached to GP practices, and they're patients that kind of support the work of GP practices to meet the needs of their patient populations. And we have a network for them and we talk to them every couple of months. We've got a voluntary sector leadership programme, which is about embedding the voluntary sector in the decisions that are being made in the ICS. We've got really good relationships with the Derbyshire County Council BME Forum, and we're creating good relationships with the Derby City Health Inequalities Partnership. We've got a readers panel. You can see that we've got Derbyshire Dialogue. We've got patient and public partners, which are basically experts by experience that are recruited to sit on lots of different boards and work streams within the integrated care system. And we have our really good relationships with Health Watch. I'm going to come on to the place involvement structures on the next slide, because this is one of the most exciting pieces of work that we're doing currently, and it's very much in partnership with the voluntary sector, particularly Michelle Skinner and James Cook from Active Derbyshire, who are really helping us with this work. And it's about speaking to people in the places where they already meet and using the best use of networks and relationships that already exist in the community. So we know that there's already lots of conversations that are happening in communities about what matters most to people, but we haven't got a way of capturing that at the moment. But if we could find a way of capturing that, then that would give us so much insight into what matters to people, and it would really help to inform our priorities and the decisions we make. And it would mean that people don't have to come to us to get heard. We'd be going to them, and we'd be going to them in places that they feel comfortable and using the relationships that they feel comfortable with. So we are looking for the ways of how we capture that information. So there's kind of, what's being said, how do we package that information up so that we can make sense of it and use it to influence our decisions and priorities. Then we need to look at how we get that to the right place in the integrated care system, because there's lots of places in which decisions are being made. And then we need to look at how we then feed back to people about how that information has been used. And so that work is ongoing at the moment, and it's linked to the place partnerships work, which is why it's called the place involvement approach. So That's the end of my bit really, and we wanted to allow quite a lot of time, like I said, for contributions. And I've just got 2 questions that I'm just going to go through now, because then you can answer either of the questions in the chat box or by putting your hand up, or you can bring in anything else that you want to say. The first question was, what already exists in your local community that we can join in with to help have those continuous conversations and avoid creating something new? Because like I say, we don't want to keep creating new structures. We want to use those existing assets in communities. And the second question was, what other methods can you think of that would help us to give people the opportunity to get involved? And I was going to put up those 10 principles again, so that you can see the kind of things that we're, what we're trying to use to underpin our approach.
Thanks,
So,
Karen. That's
yes,
a really no, don't apologise. That was a really helpful and clear presentation. I hope colleagues on this call feel the same. There are quite a few questions in the chat box which colleagues might want us to consider before we move into our questions. What do you think would work best, Karen, for you? Do you want to do that first, or should we come back to the questions in the chat?
Lenny, how do you normally do it?
If we go through the questions in the chat, and it'll give the people a chance to have a ponder on what you posed for them.
Brilliant.
No worries.
So just going back to the beginning, Mark has asked a couple of questions on what form does the service feedback take? Online survey, automated telephone survey, paper form in clinics, surgeries, etc. Are there any that are particularly effective? And do we review the data as it comes in or at a set period?
So, sorry. I'm just looking now, what forms of service feedback, right? So is this about the patient experience, about what we get people say about current services, I think is what you're meaning. And I think that there's lots of methods. Obviously, this mainly takes place within the provider trust. I think and I've had meetings with all of the experience and engagement leads in those providers, and they have lots of mechanisms for that. But I think one of the main mechanisms is obviously friends and family. They also collect data from their complaints. They also collect data from their PALS, which is kind of their patient liaison service, about kind of just informal feedback. They have lots of different surveys. They have an outpatient survey, an inpatient survey. But I think the important thing here is that as far as the integrated care system is concerned, we try to have a very much layered approach to the way that we gather feedback and experience. So we know that not everybody is going to engage with a survey, for example. So that's why we've introduced things like the online engagement platform, where people can put up ideas and questions. We try to put on focus groups about different aspects of service provision so that people can engage in that way. And that's another reason why we're trying to get into those conversations that are happening in local communities, so that we can find out what people are saying just in kind of, in their everyday conversations, because we know that not everybody is going to engage with those different methods.
Thanks, and I just come back quickly onto that one. I know I've got another question coming up underneath this one, but just quickly from my perspective, as you know, Karen, other people don't, but I'm working with Dawn Atkinson on digital transformation, and I'm on loan, if you like, on secondment from Derbyshire County Council, and I ran a survey on how people in the county used the DCC's website for accessing services. And we put out a survey, we got about 300 and odd responses. We invited about 60 or 70 of those to attend 4 different online focus groups. And out of those, about 10 or 12 actually attended the focus groups. And they were the, if you like, the hardcore people who tended to go to these kind of things very regularly. So what they said was absolutely very valid and very useful for us, but as an exercise in reaching a whole broad demographic, it wasn't massively successful. I just want to try and break away from that, and that's why I'm here, really interested in finding ways of getting into these communities which are more, if you like, difficult to reach.
Yeah, and I think that's why we created relationships with the Derbyshire County Council BME forum as well, because obviously the representatives that attend that forum have a huge reach out into their communities, and also the Derby Inequalities forum, which is made up of people who actually experience health inequalities. They've got a really good reach into their communities, because it is about using those existing relationships that people already trust, because people aren't going to, like you say, they're not going to come along to the things that we want them to come along to. We've got to find a way of getting out to them, and that's why we're doing this big piece of work around finding out what local assets are already there, where we can gather the insight in from people just having conversations normally in their own kind of groups and networks, and use that information to help to feed our decisions. Because with the best will in the world, no matter how hard we try, we're not going to be able to put on methods that everybody's going to want to get involved with. So I do know what it feels like, Mark, to do that kind of thing. Yeah.
Well, it's great that face-to-face is an option now, because you know, when I was doing this last summer, it wasn't an option. So to actually be able to go and visit people in a more kind of like intimate setting, I think would be really useful.
Yeah, yeah.
I think just to support Karen in response to your question, Tony, that the role of the voluntary sector and the alliance that's being shaped working with Joined Up Care Derbyshire, I think is going to be really important as part of our engagement strategy, if you like, to really help us understand and further reach different communities than those more traditional groups that perhaps would engage with us historically. Thank you. Do you want to go to the next question, Lenny?
Yeah, so the next question is from Tony. How do I, as a small community group runner, share all the information I gather daily? And also the really important point that most of our service users don't have technology ability or access, and where does that leave them? And I think that comes into going back out into the community and actually visiting these groups and talking to them.
So can I come in with that for Tony? Is that okay? Because Tony, that is exactly the question that we're asking ourselves. How do we gather that information together in a format that we can use? And we have got a task group that's been set up and to look at that very question, and we've got a learning network of everybody that's interested in finding the answer to that question being set up as well. So I know I haven't got the answer to that question on my own, as you haven't got the answer to that question on your own. But if we can get lots of interested people into one room together, maybe we can find the answer to that. And it might, some people have suggested that it might be a digital solution, but I don't necessarily think that that's the solution either. Lots of people are grappling with it. So Tony, if you want to get in touch with me, I'm happy to link you in to that, because it would be really good if you have got information. It's kind of, at least we've got some information there that we can then say, right, well, how do we get that through this process to ensure that it's influencing decisions?
Can I just give you a little bit of a context and perhaps a little bit of my vision with that? We've got a very small community hub, which includes, for some days a week, having a food table outside of my house for people to collect free food. And they come and they talk and they share lots of information. And because we've got a community worker from Derby County Council in the community, I've been able to refer some people who've got serious issues to them. And it's an aspect of me knowing where I can refer people to, who I can ask. So I become a channel along with my volunteers. But also there's some mornings that we do a coffee morning. And in that coffee morning, we have lots of people who do not have digital expertise. But I'm trying to collect together some small tablets, laptops, and I've got myself a screen and a projector, trying to teach people how to access the internet, and I can show your website on there. I can get these people to have their own email addresses. They can come and they can log in, they can make hospital appointments and all other kinds of things. And we can show them, although they've never seen this type of thing, we can show them around the websites, show them how they can get information, how they can take part in surveys. So that's a part of a vision of where we're trying to go. It's just trying to get together the funding and things in order to get the machines in order to do that. But people just come to us and they talk about their experiences, and it's just knowing where to turn to in order to be able to get some expertise of where they can get more information and where they can get answers, and the things we can deal with ourselves, because we've done the mental health awareness training, so we can sort of gauge what's going on with people. And sometimes we can deal with things ourselves just by listening and talking and giving advice and building up friendship groups. And so we can actually save money at our end by the things which we're doing. But I think when we've got something like that, where we can give people access to all the information and give them capability, give them confidence, then we can help at this end of the service to make it easier further along the line, because we're having massive problems with people who just can't make doctor's appointments, and we can help give the people the information that they need to perhaps be able to do things online a bit more.
Tony, I think you've described what the, and I don't know all the ins and outs of this, but Public Health have got an initiative called Community Champions, and it sounds like you are the definition of a community champion, Tony, who very much goes out, and they were set up as part of the pandemic to make sure that people got the correct information, you know, in order to manage the health aspects of that. But they're now morphing into kind of, you know, how do we make sure that people have got all the health and care information that they need in local communities? How do we signpost people? So if you want to get into, like I say, if you want to get in touch with Tony, we can address quite a few of those things and make sure you're linked into the right places. And there's quite a few of you that are doing that work around digital inclusion, you know, trying to get people online. And I know that there is, you know, work taking place as to how that kind of work around digital inclusion is it is more consistent across the county. So I can also try and link you into the right place for that as well. All right, well done though, doing a great job, Tony.
Thank you. I'll just give you one example. We had a lady in her 80s who came in, and we've been giving out the COVID materials. So we were giving out lateral flow tests and everything in our stall. And this lady in her 80s came in, and we said, would you want some lateral flow tests? And she said, yes. And someone said, do you know what to do with them? And she said, no. And so we actually demonstrated and helped her to do a test. And she went all round the hall showing everybody, I haven't got it, I haven't got it. And when we can do that in that service, it's no good just giving the things out. She just didn't know what to do with it.
Thank you.
Thank you,
I'm
Tony.
just going to quickly jump to Richard, because I can see he's got his hand up. So, and
a few moments ago, we were talking about health inequalities. But let's not forget that the people on the lowest incomes in society are the people that you worry about, because they're the people who cost you the greatest amount of money and require the greatest amount of service. They're also the people who can't afford broadband and all these luxuries. I regard myself as lucky because I look at my phone and it says, oh, you've only been online 2 hours today. Are you know, oh dear, how terrible. Some people have to look at, do I pay for that? Do I buy my food? Do I pay my electricity bill? And here we are, jumping for joy. Come on, we've got to have a clear understanding of the people who need the service. We have to find some way of dealing with this situation if we want them to be in the digital world. And finding them spare tablets or spare phones is a very clever idea, very generous, very warm. Who's going to pay for it? It's not a cheap thing anymore. When I look at my bill every month, I think, what did I get for that? Did I get real pleasure out of it? And I look at what I did, I think, really, come on, you know, this is a luxury, a social luxury, isn't it? I haven't saved my life because of it. I haven't improved my wealth because of it. I haven't improved my health because of it. It's cost me an awful lot of money. Come on, let's get a grip on this understanding of the needs of the people who need the service. And they're the people who are not driving around in big cars, who have fancy houses, who've got every child in the house has got a computer or a phone or both. We've got to remember there's an awful lot of people who use food banks all the time. Or they're following the Ashfield MP who says you can feed yourself for 30p a day. Everybody pulled a face at that, but a lot of people are trying to do it. So, you know, I think we need to get real.
Thank you, Richard. I think you've kind of got to the heart of some of the probably the single biggest challenge that we've got, haven't we? And as we said earlier, COVID shone a huge light on the house inequalities that exist across the country, and we have our own share of that here in Derby and Derbyshire, and we know, don't we, that our poorest in society have the poorest house outcomes, and that's where we need to target our support better, both in terms of understanding what some of those real everyday issues are for those communities and how we can better reach them, but also how we can better help shape their health and well-being. One of the strategies, I guess, within the opportunity that we have as we move into an integrated care system is working much more closely with our local authority colleagues and our public health colleagues, because we know that the determinants of health, or the social determinants of health, aren't just about access to healthcare. It's actually about access to meaningful employment, access to good housing, supporting children to have aspirations and support them to be in school and to stay in school. It's a whole host of things that sit outside of the NHS. So one of the probably the single biggest key driver of this change is about how do we better join up the conversation between the NHS organisations and the local authority organisations to really start to address what it is that you've set out, and how together can we have this dialogue with our communities, citizens and people in Derby and Derbyshire. And I think also what you raised around the mechanisms for engaging with people, Karen's really helpfully touched on through the questions that Mark and Tony have raised around we have to take account of the different ways to best engage with people, and it can't be a one size fits all, and it can't just be a reliance on technology. It has to be a whole plethora of different ways of how we have meaningful conversations and discussion with people, and listen and take account of those views. Lenny, would you like to move on to the next question, because I'm conscious that there's a few other questions in the box as well. Thank you.
So Val has said University Hospitals of Derby and Burton transfer inpatients between Derby and Burton hospitals. On leaving hospital, are the two new systems, Joined Up Care Derbyshire and Better Together for Staffordshire, working together to support these patients if they're not in their own county on discharge?
Yes, they absolutely are, Val, and you've raised a really another really important question. So absolutely, we know, don't we, that United Hospitals of Derby and Burton is a combined trust, but that it does straddle two counties, so Derbyshire and Staffordshire. We have a number of joint work streams. Discharge is a really big, complex area of work that we work collectively on. So yes to that question.
Thank you. Jeannie Robinson, you've got a few questions, so I was going to invite you if you wanted to actually ask them yourself, and then you can join them all up together.
No, not really. I'll let you read it out. Thank you very much, Lenny. Thank you.
Okay, so Jeannie has asked.
I can do the first one, Lenny, which is I've got it here. I think you're part of the Amber Valley CVS Connected meetings, and you've not seen the CCG or ICB attend one yet. I can address that one. So just before the pandemic, I'd been employed for about a year before then, and I was going round to all the different groups. I went to carers groups, dementia groups, voluntary sector groups. I kind of did this like roving workshop, informing people. At the time, it was the Sustainability Transformation Partnership, not the Integrated Care System. I think now that the pandemic is starting to peter out a little bit, touch wood, those kind of sessions will be resurrected, and anybody can ask for those, and I'm more than happy to come along to groups and talk about the new Integrated Care Board and the Integrated Care Partnership and the ICS as a whole, and what that means and what the vision is. We have some explainer guides as well that you can use. One just kind of talks about the vision for the integrated care system, and then there's another one that talks about all the boring stuff around, you know, how it's all going to work and what the processes are for people who like that kind of stuff. And then there's another one about the history of the integrated care system. So there's those, and they will be supplemented over the coming months with other guides that are for different audiences. So I'm sorry that you've never had the chance to hear about it before, but it's not that it's not been happening. I guess it's just that Derbyshire's a huge county, and we've been potting along to different groups to what you've attended so far, I guess. The one about how is primary care going to be integrated in the ICB, I think is one for you, Helen.
Yes, so I guess just adding another complexity of different acronyms. So we have primary care networks or PCNs, which are basically groups of practices, GP practices, working together across a geographical boundary that form part of the integrated care system within Derby and Derbyshire. And there's different groups of practices now starting to come together to really start to better plan together, better plan services together, and starting to think through and address not just the health need of patients on their list, but actually more broadly about what's needed for that particular community of patients across a geographical area. So PCNs, or primary care networks, are a really important part of the new integrated care system going forward, and they will work very directly with places in terms of planning at that population level, and will be able to inform and shape and feed into the wider strategy of the Integrated Care Board. They will also have a place as a board member on the new board going forward, to make sure that that voice of primary care is heard at that more strategic level, as well as the operational local geographical level.
And then your other question is, how is social care going to be integrated? And I think a really good example of this one, and I'm sure Helen will come in as well, is the team up approach. So there's this initiative called Team Up, where lots of different kind of teams, if you like, in social care, in primary care, in community services and in hospitals are all working together to kind of provide holistic care to people that are currently housebound, to keep them independent in their own homes for longer and to prevent them from being admitted to hospital, or if they're admitted to hospital, to help them get back into their own homes as soon as possible. And you know, social care is being integrated into initiatives like that. Obviously, I get that you're saying that social care is creaking and it's at breaking point, but they're doing this on a kind of a small pilot basis to start with and then building it up, because obviously this kind of transformation is going to support the challenges that all our different system partners face at the moment. So if we can get it right, it should actually help to support the kind of staffing issues and the resourcing issues, because it's helping people to not need you know high intensity support. Is that right, Helen? Have I got that right?
Yeah, no, that's great, Karen. I think that gives a real example of how teams are working much more closely together to address some of those challenges. I think that's a great example, and undoubtedly there will be others. But I think just adding from a planning perspective, the teams are now sitting together, formally sitting together to look at what the priorities are, allocate resources, take decisions. Whereas perhaps before it was less joined up, and that's certainly our driving ambition, is that we do join decisions up as well as care and the provision of services as far as we possibly can, so that we're not getting people bounce between systems and bounce between organisations. Clearly there's a way to go, because I think we can probably all give examples of where we've either experienced that ourselves or for our families, but that's really driving the integrated care agenda about how do we bring these organisations together to make better decisions.
So,
thank you.
So
where do you want to go next, Lenny?
Jeannie, your hand's up.
It was just a very quick comment. So I'm a social prescriber now, working within a PCN, and we're just getting team up sort of going. It's at very early stages, but there's no mention of social care being involved. And DCHS are already doing this through their care coordinators and the staff based in practices. They link in very well with discharge officers from the hospital and social care. So are we not duplicating a service that's already there?
I think it's about enhancing it and making sure that it's rolled out more equitably across the county. I think it's perhaps been arguably a bit patchy before, so it's about how do we better resource this going forward across the whole of the patch rather than just in isolated places.
Thank you.
Thank you.
So there's a lot of great comments about places we can go to, suggestions of the WI and community hubs. So we'll pull all of those out so we can contact people and find out further details on those. More comments obviously about issues around technical, people having difficulty accessing computers. Anne has said that some patients have told her that they're not seeking help anymore because they can't travel and have difficulty using computers. So again, feeding into that, making sure that we're contacting people and getting feedback and supporting them with regards to that. Just scrolling through, there's been a lot of interaction in the chat, which is absolutely great.
There's loads of it.
There's loads of it. It's fabulous. That again, raising issues with regards to patients having to go through 111, not being able to get through, and that using up their time when they're on hold to GPs, or when people have a pay-as-you-go phone, and that feeding into poor health and health inequalities. There was a question down here I wanted to go to. Carol asked, is in an emergency when ambulances are delayed, would it be possible to set up a group similar to blood bikes who'd be able to take a defib? I think that somebody has mentioned about the community response officers in there, but is there any way we can communicate more about that? Or
well, we can certainly take the questions back to the commissioners, Lenny, and get a response out on if we've got very specific questions on particular service areas. And I note the question as well around mental health, and that around the placements, out of area placements, I think is what the question's around. So I think what we can do after this is pull off the specific questions relating to specific services and make sure we get a response to colleagues on those, certainly. And it may also be, I don't know how colleagues feel, but for future Derbyshire Dialogue sessions, if there are particular themes that we're seeing, it may be that we bring one of the commissioning team to talk about a particular service or particular development and get sort of thoughts on that. Is just an option or a possibility.
Absolutely. Leslie, can I come to you, please? You're on mute.
We all do it, don't we? Sorry about that. Thank you. And thanks very much for these sessions. I think they're really helpful and a massive step in the right direction. I just wanted to offer that we've developed quite a reasonable model for patient engagement with the PPGs and the neighbourhood groups. And I think we're open now for discussion time to change these. I think the relationship between the PPGs and the practices and the neighbourhoods that they work in, it's time for a revamp. I think we can do so much better than we're doing. So I was going to contact you anyway, Karen, to sort of say, could we meet up to have a look at this as a starting point and how we might be able to develop it further? Because I think there is so much mileage in getting the public involved and engaged and getting them. I mean, who wants to come to a PPG? Let's be honest. If I was 17, I wouldn't set foot near one. But we need to be connecting with so many more people, and we need to find ways of doing this. And I think we can. And one of the ways we're doing is connecting more strongly with our voluntary sector, so that we can link in and have representatives go to meet groups, for example, to say how you're doing, and going to schools with our public health officers and things like that, so that we're not duplicating it as well. We're getting the information and being able to share the same stuff. So I would really enjoy the opportunity to have a conversation with you and further develop that if that's possible.
Yeah, you know, I'm always happy to speak to you, Leslie, and we've already had a few conversations about this, haven't we, about how we can do it. And I think Glossop is a really good community to do that in as well, especially with the transition happening. Really important that we do hear what people say. So yeah, definitely.
Thank you, Leslie. Thank you, and thank you for joining this afternoon, sharing that. We've got a lot to learn, I think, from colleagues up in Glossop. So welcome that offer. Can I make a suggestion, Lenny? Conscious of time, and I know that Amran's had his hand up for a little while. Can we take Amran's question as the last question? Yeah. And then I think we'll look to close the session if that's okay. So we'll hopefully close bang on 2 o'clock if that's all right.
If anybody has any questions that they haven't had a chance to raise, if you want to email them to us, I'll put the engagement email in the chat again, and you can send them through to us, and we'll pick those up offline. But Amran, if you'd like to ask the final question.
Yeah. Hi, Karen, and hi, Helen. And on observation, it's great to see Andrea doing sign language. That's fantastic. Could I ask that when we do come with any data or statistics as to where the health inequalities lie, we provide feedback. So that feedback would come from yourselves, and you would so present it and say, okay, this is what we've learned, this is our data, and this is what we're going to do about it. Because I think that's quite important for the communities, because they don't, I think due to their experiences, that there's a lack of trust in whether or not anything is going to be resolved, or there's going to be any concrete action in resolving health inequalities. And I think that's quite important that that's presented, so people are aware of what's going on. I think that's it for me. Thank you.
No, really, really important comment and thoughts there, Amran, and thank you. And I think if we were to share data and information around how we supported and talked to and got the support from different communities around the rollout of the COVID vaccination, I think that would demonstrate, I think, the point that you're making about how we build trust and support and that relationship with our diverse communities, different age groups, different ethnicities, across different social demographics across the city and the county. But you're absolutely right, it's that evidence and the information, but most importantly, what does it tell us, and therefore what are we going to do about it is really what people want to hear and be part of. So thank you. Okay, I think we're probably a few seconds off 2 o'clock. It's been an excellent discussion, lots of comments, lots of questions, and I know we haven't perhaps got to every single question, but hopefully we've got to most of the comments and questions, and certainly the essence of what's been shared this afternoon. Hopefully you found it as useful as I know Karen and Lenny and I will have done. I don't know when the next one is scheduled, but I'm sure they'll be looking at dates and themes very soon.
I can tell you when the next is scheduled.
Go
the
for
next
it,
one is
Lenny.
scheduled on the 29th of June, and actually it's feedback on an end of life survey that's been done over the last couple of years. So we're going to be providing feedback on that, and also the next stages in end of life planning and care that we're looking at for the system. So that's on the 29th of June at 2 p.m. But meeting invite information will be circulated after this meeting.
Lovely, thank you. And just a final thank you for your contribution and attendance and thoughts and feedback. It's really valued and really valuable, and look forward to seeing some of you very soon. Have a good afternoon and take care.
Thank you.
Thank
Bye-bye.
you.